Welcome back to another episode of Thanks for the Consult. I'm Fior. As always, we have Aaron. Yes, it's as most times we have Aaron. And today our guest is Megan. How are you doing, Megan?
I'm doing all right. How are you guys?
Doing well. Doing well. So I know you. I've met you before. I think today's the first time you met Aaron. But why don't you
Mhm.
tell us a little bit about yourself for those in the audience that don't know you?
So I am a paramedic. I got my medic about 2 years ago. Went through the center program on a scholarship from the Passman Hospital Foundation, so that was pretty cool.
Cool.
Um, I get all kinds of jokes about being a center medic. But before that, I did the advanced DMT thing, and I actually am not like most people, and I got my start in the ER, and I never really did fire until recently. I joined the fire department just to help with medical calls because I live
Okay.
in the middle of nowhere.
Nice. Yeah, we see a lot of people that, got their start. They were volunteering at the fire department, had a call that they were like, I don't know what to do. And then they go to EMT class and then decide
Mhm.
that they would, this is an awesome job. And then they go to medic class or
How does it feel to
what
be a
have
Mhm.
you.
reformed AEMT?
It was it was nice when I was going through class for my medic because I'm like, oh, I already have like an intro into most of this stuff until I realized like I don't know my ass from a hole in the ground. So that was
Yeah.
great.
I've always noticed that most of the A's that I would consider to be like the really good ones tend to end up wanting to go to medic class anyways. You know what I mean?
Well, my plan initially, like, so I started in the ER back in 2016 as a tech.
Okay.
Because the ER that I was working in, really the only requirement for the techs was that you had to be a phlebotomist, which I was.
Okay.
And I worked in the ER for a couple years and then realized like I actually really like this stuff. So I worked with my boss on my schedule so that we could make it, work for me to go to EMT class because I had a like not a set schedule, but I had to work every other weekend, which became difficult because I had class on Saturdays. But my boss was awesome and had a background in EMS too, and she helped me make it work. But I stayed full time in the ER and started running on the truck part time and realized, oh, okay, this is pretty cool. I do really like this. But my plan at the time was to go to nursing school. And I figured, okay, if I get my advanced DMT, I'll get about the same pay that I'm making in the ER and I'll have a better schedule to go to nursing school. Cause in the ER, I was working 212s and 2.8s, which not really great for school, but I got my advanced, worked on the truck full time for like a month, and I was like, yeah, I'm not going to nursing school.
You got bit by the bug,
No,
you know?
I did.
I
And
mean,
I'm cool with it because I love what I do. We really do
yeah,
have the best job in the world.
I agree 100%. I have a presentation called that. So, you know, I agree 100%. But yeah, no, that's pretty good, pretty interesting. I guess origin story would be the word if
Hmm.
this was a video game or a movie.
Hero arc.
Hero arc. Okay. Um, I mean, Aaron, you were bored on a Thursday, so you took an EMT class, and then you know somebody told him he couldn't make it through medic class. He's like, bet. They went to medic class.
All my accomplishments are done out of spite.
I mean,
Yeah,
aren't
hey,
aren't
whatever
most of
works.
the greatest accomplishments in the world done out of spite?
That's my advice to all medic students too. I'm like, just let the resentment just harbor inside of you. Let it build up.
Listen,
We
that
don't
is
let it
what got
preset.
me through the very end of medic class. It was
Right?
just wholly out of spite because I had one lab instructor who was difficult to say the least. And
What's
at
their
one
name?
point he actually told me to quit. No, no,
It's
I'm not dropping that name because yeah, no,
fine.
I ain't doing that to
You'll,
myself.
You'll have to let
But,
me know offline.
oh, I will. I will. Absolutely will. But, he actually told me to quit. Like he gave me a panic attack and told me I should just quit medic class. So
Uh,
from that point on, it was just like, okay, now I'm just going to do this out of spite.
Fair enough. Fair enough.
Is that why you
it,
continue to be a paramedic? Because despite
Some days, some days, like those days where I don't want to get out of bed, I'm like, no, no, now I have to get up just so that I can tell him that my card says the same thing that his does.
yeah, there's that. So you do some interesting things in EMS. At least per your Snapchat stories, you do a lot of event medicine, uh, concerts, hockey games, football, baseball. I'm assuming.
Yeah. So where I work, we have the opportunity to go and help with some of the city events, and I've gotten to work a lot of concerts, Pens games. I think I worked one Steelers game, lots of Pirates games.
Yeah,
A lot of it's, hurry up and wait.
yeah.
Most of the
Uh,
Pirates games that I work end up getting delayed somehow, usually by rain.
in Pittsburgh, shocker, rain delay.
Yeah.
What do you how does that compare to running on the trucks? I mean, I'd imagine it's probably like you said, a lot of hurry up and wait. So, but whenever things go bad, they like make national news, like people
Yeah.
jumping over the, the barrier and
I was
landing on the
working that
field.
day. I was
Okay,
working that I was working that game. Um I unfortunately did not go down to the field for
okay,
that one, but I stayed and manned the first aid room.
okay.
But no, like we have a really good opportunity because like the city does a whole lot of training that a lot of other places don't.
Sure.
So the guys that I was working with that day, they were on top of it. They knew exactly what to do. Everything ran super smoothly. Um, I have been there for my fair share of crazy events. Like my very first event was the Ed Sheeran concert.
Oh yeah, I heard that was pretty mundane. Nothing crazy happened.
Oh no, nothing at all. Nothing at all. And the funny thing was like, so I got my medic on July 5th and
Okay.
that concert was on July 8th. So I had been a medic for 3 days. I literally got my card in the mail that day. And I was so
Nice.
excited. I was like, oh, I get to wear my new paramedic shirt. And, yeah. And then, some guy decided to just go into cardiac arrest in the middle of Art Rooney. And
Yeah, yeah.
how
We're
nice of
familiar
him.
with him. We've had him
Yeah.
on the show a couple times now. But yeah,
Yeah,
no,
he
that's
kicked my butt through medic class. Like he was
uh
one of the ones that pushed the spite.
okay.
And, it was almost like he was like, you
Best
passed your
time.
psychomotor, you passed your written, but you know what? I think you need a mega code too.
There you go. Well, obviously, everybody that was there working it, you guys passed since
talk about dedication as a preceptor. This man threw himself into
right.
cardiac arrest to make sure that you were prepared.
Well, and he wasn't even my preceptor. He was just one of my friends that was like, that I would text and be like, listen, I'm gonna quit. Today's the day. And he'd be like, nope, I already talked to your preceptor. You are going to lab, whether you like it or not, because I talked to him and told him to deliver you to the center if he needs to. I'm like, oh, that's great. Thanks.
Nice. Nice. Yeah, but back to the whole center thing. I think we've discussed this in other episodes, maybe with Caitlin. I can't remember, but the center does get a bad rep at times. But
Mm.
some of the best medics I've ever worked with have come out of there, and some of
You
the
know,
worst. And you can say that for I think any educational institution. It's
mhm.
yeah, but it's definitely um, an interesting setup they have. Um, so
It really is a great program. Out of I think there were 24 of us that started class. Um, 22 of us finished and passed, I believe.
okay, yeah,
There was one of the two that didn't. She just decided not to test. For whatever reason, she was like, you know what, this is just going to make me a better EMT. And then I think there was one person who just didn't finish.
interesting.
That was an
Okay,
expensive way to
Yeah,
improve your skills as
I'm,
an AMT.
yeah,
Yeah,
Uh,
yeah.
I would venture to say that's probably fear. She's letting the imposter syndrome win.
Hmm.
Um, and I would say to that individual, go test. You put in all the work, go test.
Right.
But
Like
yeah,
the imposter syndrome was real.
oh yeah, yeah.
There's
I mean,
there's even still days, and like I said, I'm almost at 2 years. There's even some days now where I'm just like, is this really my life right now? Is this what is actually happening today?
yeah. Well, I mean, we were just talking to Taylor on the last episode about, calling people still, and he's been a medic for, I don't know, a minute, what,
A couple
19, 20
like
years almost?
millennia.
Yeah. And I mean, he still calls and is like, hey, this is what
I'm
happened.
gonna get
Did I
yelled at
do
for
it?
telling that.
But it's fine. I'll make sure he watches it, If he
I
doesn't,
called him
he
my
won't know.
dad, so you're gonna be all right.
Yeah.
I did see that. I did see that.
But,
And there's a family reunion.
yeah. But yeah, I mean, I think everybody has those calls that kind of you're like, I think I did the right thing. I should probably double check. And you know
Yeah.
that that's what we have Medic Command for. That's what we have. Our medical
Hmm.
directors, our other paramedics that we trust and respect.
Dude, EMS Reddit page, that's
Oh
fielded a lot of
God.
my questions.
I
Uh,
am afraid of Reddit because of where it can lead.
I try not to source my information on anonymous websites that anybody can post.
It's where I get all
'Cause,
my answers from for everything.
I mean, it's
Yeah.
working out for you so far.
I mean, I
So
did a
like
little bit of real college, and all it really taught me was how to professionally Google anything. So,
a little bit of real college. I like that. Aaron's
yeah,
trying to do a lot more real college.
I know.
Aaron
I
doesn't really
I
want to, but he
saw that
has to.
you have to, really have to.
I mean, I don't have to, but I guess I am.
Somebody told him he couldn't. So here we
Are you guys
go.
familiar with the sunken
Oh,
cost
oh,
fallacy?
Yeah.
hmm,
Yep.
That's kind of where I'm at, Already put all this effort, Might as well continue to make
yeah,
myself miserable for a few more years.
yeah.
Fair
At least a
enough.
few.
Fair enough.
If I make a lot of money at the end of it, I'm fine with it.
Yeah. Well, like
I
what
mean,
what amount would that need to be?
At least like $30.
Oh yeah, I think you'll be fine.
yeah, you'll be fine. I mean, I did a couple years of college back whenever I had no idea what I wanted to do with my life. And somehow in the process of taking these EMS classes, I realized what I want to do. So
Nice.
I am also looking into going back to school to at least get my bachelor's degree in public admin.
There you
So
go.
yeah.
What did you start to take?
I actually started college as a music education major. I was going to be a music teacher.
What instrument?
All of them.
Yeah, but like every music education teacher, they're like, this is my instrument.
Yeah, and I get the most jokes because I played the flute.
Nice.
Hmm.
Why are you laughing, Fior?
Your reaction was
There's nothing wrong with
priceless.
playing the flute. I'm
In
sorry about
fact,
him.
I tried playing it for a year in elementary school. It didn't go
Yeah.
well.
Yeah,
So
I started playing the flute and then I switched to, for marching band, I started playing the piccolo because it was smaller and I was
More fun to
lazy.
say too.
way more fun to
Yeah.
say. Yeah.
And
Piccolo.
then I learned saxophone so I could be in jazz band. And then I joined drum and bugle corps, um,
Drummer or
and
bugler?
learned percussion and was playing either the snare drum or the quad.
Okay.
And then I learned trumpet and mellophone and baritone.
So you literally
What is
just
a
So
learn them all.
mellophone?
pretty much the only two that the only two regular ones that I really can't play are I've never tried playing the trombone and I can't play the clarinet.
The
And
trombone is
then
arguably one of the most fun too, because you get to go.
yeah.
What's the difference between a mellophone and a French horn? They look the same to me.
So
French.
whenever
Perfect.
I was in marching band, the people that played French horn and symphonic band played the mellophone during marching band.
So it's the
So
same.
The same.
it's not the same, but they're similar.
Like one's French and one's not.
Sure.
See?
So, did you guys see the movie The Interview? It's like
Yes.
Same, same. Different, but same, same. That's I don't know. It's kind of where my head's at with it. That's pretty cool. So you were a band geek,
I
right?
was a band geek.
Oh yeah. So you have tattoos. So which instrument do you have tattooed on your body?
I don't have any instruments I do
What?
no. I mean, is the heart an instrument? I have a heart.
Is mayonnaise
Uh,
an instrument?
I don't think so.
As soon as you said that, it came into my mind. No, I've got a bunch of flowers and a hummingbird, and my dog is bringing me toys right now. Sorry.
Perfect. But
Some butterflies.
you're the only like musician in the world, I think, that has tattoos and does not have an instrument or like some type of music making or reference, I guess, tattoo.
Yeah,
Usually it's a
it's
pair of
just,
eighth notes. People love eighth notes.
Yeah.
yeah, I don't know. I never got any kind of music stuff tattooed on me. I
Yeah.
have, I have a quote on my back. Um,
About music.
no.
Uh,
So I took Latin in high school.
okay.
And every week we would take a quote and throughout the week we would translate it and then discuss it. And the one that kind of stuck with me, it was from Ovid. It means be strong and patient. Someday these hardships will be useful to you.
It's probably some wisdom in there.
Yeah. I mean, it's Ovid. So, I mean, he's supposed to be wise.
Well,
My favorite
I'm
Latin
supposed
quote
to
is
be
Carpe
mature.
Diem.
Is that the only Latin quote you know?
Maybe.
You know, carpe noctem.
Don't 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 show me the body.
Seize the day and seize the night.
That thing, yeah.
Yeah.
Habeas
So,
corpus, that's what I was thinking of. That's my favorite.
habeas corpus?
Yeah.
Oh,
Show me the
okay.
body.
Wow, you're special.
Correct.
Ah, man. Anyway, uh, you're an insane person, but we love you. You're our
Thanks,
insane
so.
person. Yeah, anytime.
Could be
Uh,
worse.
yeah, yeah. So, what? We forgot to ask you the all important question here.
Okay.
What's your favorite IV catheter?
Now, are we talking size or are we talking brand
Miss
or
Both.
both?
You just tell
Okay.
me all of it.
So I don't really have a favorite kind of IV catheter, except I'm gonna catch flack for this. I'm not a fan of Gelcos.
You're
I
not going to
just,
catch flack from me,
yeah,
but
my partner at my full-time job, he swears by the Gelcos. Like, I'm not joking. He asked my boss for a box of 18 gauge Gelcos for Christmas
did he get it?
because no, he did not.
Nah, big
He did
sad.
not. He was big sad. He gets real excited whenever he'll find a random Jelco in the IV supplies though.
Yeah,
Just
you
he's
know
like a
why
little kid on
there's random
Christmas.
Jelcos in there? Because everybody else hates them.
Ex
Throw them in there when they
right?
find.
I mean, my go-to is an 18 or a 20,
Okay.
depending on the vasculature. But like occluding versus non-occluding, like I learned how to start IVs with the non-occluding ones. So, I mean, the ones that self-occlude are just, they're a perk, I guess. They're helpful, but
But
I
to
don't have, I
settle
don't
the
have a
debate,
like, okay.
if you could have one over the other, which would you prefer?
I'd probably grab one of the self-occluding IVs before I grabbed one of the non.
I agree.
I have no problem using either of them. I actually, it was funny whenever I was still working in the ER. We had this one because we had regular techs, which is what I was, and then we had advanced techs, which were just paramedics. And we had this one medic who started working there part time, and he was so used, like he had only ever used the self-occluding IVs. So what we had at my hospital were the non-occluding ones. Like you had to occlude them yourself. And he didn't even try. It was, he would literally just, whenever he went to start an IV, would get like a little stack of 2x2s and put it below where he was gonna poke, and he would just like let them bleed until he screwed the cap on.
It's one method for sure. That's
I'm
one
like,
method
it's
for
not
sure.
it's not that hard to just occlude the vein, but
No,
okay.
it's not. But I will tell you, I do like this self-occluding, especially when you're, um, doing it in the ambulance,
Oh
tight
yeah.
quarters, moving, what have you. So,
Hmm. A little
but
less messy.
but Aaron obviously does not agree with me on this matter.
The
And
wind's
that's
in the
okay.
way. There's a lot of things I don't like about him. Okay, quit picking on me. Quit bullying me.
I bully you into, you know,
It's gentle bullying.
out of love.
Now it's gaslighting, is what it is.
You do love a good gaslighting, don't you?
Well, I like to do the gaslighting.
Oh, I thought it was like a two-way street. Like you like to
No,
gaslight and be gaslit.
no.
You
Do
just
unto
like to
others
do
as
it.
you wouldn't want done unto you.
Yeah, I think that's probably not. Um,
That's how it goes. That's the old adage.
yeah, no, there's extra word that you added in there.
Yeah.
No, that sounds about right.
Yeah, you should probably go get that tattooed now.
Well,
No
I saw it on
regrets.
Reddit.
That's how you know it's true. If you see it
Facts.
on the internet, it has to be true.
Absolutely.
There's no such thing as lying on the internet. Uh, uh yeah. So you said 16 you got into EMS 2016
2016 is when I started in the ER.
ER.
I got
Okay.
my EMT in 2019,
Okay.
and
Very
then my
cool.
advanced in 2021, and then I got my medic in 23.
Okay. Right on. Right on. And I know you're an instructor now,
Hmm.
correct?
Yeah,
Um
I am teaching at two different places, or at least
okay.
I'm supposed to be.
Fair enough. Um what level are you teaching at? EMTAs, medics,
So far,
EMRs?
so far the only classes that I've taught are the EMT classes.
Okay.
But he said, um, the the one lead instructor said that he might have me helping with the advanced and medic classes.
Yeah, I would be absolutely useless in an advanced class. I
Well,
am
and that's
so
why I
confused by their
offered
whole scope.
uh, to this day. So my one partner that I worked with through the entirety of medic class, to this day, he still has no idea what medications an advanced EMT can give. I was
What
like,
does they keep
you were my
changing it?
partner for a year.
Uh,
It was like, I think a week after I passed my test and I was working on, my calls to get on command for my medic. I mean, even though I was already on command as an advanced, I still had to do all the extra
yeah.
calls. But I told him that, oh, I had a diabetic call or something and I had hung D10. And he's like, oh, it's pretty cool being able to fix that. I'm like, dude, I already could. He's like, what are you talking
Yeah.
about? I'm like, I could give dextrose as an advanced
Yeah.
EMT. No, you
Well,
couldn't. Like, okay, okay.
yeah, I had a place I used to work. Uh, we ran double medic trucks
Hmm.
predominantly, and then they would have one person on the shift that was an EMT, and then they hired an advanced EMT and put them on in like the EMT role or spot rather. So like nobody knew what to do with them. It
Hmm.
was like it was so they ended up just getting all the BLS calls as if they
Yeah.
were EMT basic. Because it's like I don't know, either I go every other call or I take all the ALS calls and I give all the BLS calls to the EMT. I don't know what to do with this advanced
So
EMT.
I had I do 224s and I worked the same schedule basically while I was going through medic class. And my one partner, he gave me all the BLS stuff because he didn't understand, he didn't know, he didn't read my protocols, so he didn't know what I could do. My other partner, he let me take whatever I felt comfortable taking. Like obviously he would take the anything cardiac related or anything
Sure.
that needed to be on the monitor.
Yeah, makes sense. Makes
But it was it was nice because it let me challenge myself, but like I also had to know like my limitations of okay, this has the potential to go this direction, so I can only handle up to this point. I should definitely let him handle this one.
Yeah, that makes
But
sense. Makes a lot of
yeah.
sense. But yeah, it's. I think it's. I've I've asked that, and my medical director is great. He's given us a lot of direction on this. But we asked at one of our trainings, like tell us how to handle these situations where because what I'm comfortable downgrading when I'm in the front of the truck driving
Hmm.
is very different than what I'm comfortable downgrading whenever it's like, all right, see you later, and I'm getting in my
Hmm.
truck and leaving.
Yeah.
Because if anything changes and I'm up front, cool, we just pull over, Chinese fire drill, slap five,
Hmm.
tag me in, coach. But if I'm not there, then it's like, obviously you can't intervene if needed. So
Yeah, like obviously, like I don't have any experience as a response medic, so I can only imagine that how kind of frustrating, I guess, is the word that I would want to use. That could be because it's like you're so used to being able to, if if something changes, just like you said, Chinese fire drill, like let my partner tell my partner to let me know if anything changes and then I can swap out. But unless you plan on following the crew to the hospital, which
lately,
kind
that's
of,
not even been an option. As soon as I clear a call, they've been banging me out on something else.
yeah,
But
I do hear you stay pretty busy whenever you're up there.
I try. But no, it's interesting. It's definitely a dynamic that is difficult to keep up with. I think, especially if you don't regularly work with somebody that isn't advanced,
Hmm.
because theoretically they would be on top of what they can do, um, and they could kind of let me know. But
Hmm.
yeah, but yeah, so it's um, but ultimately it's kind of everything falls back to your discretion
Hmm.
as a provider. Right on. I like it.
The thing that always frustrates me is like every symptom could be a cardiac symptom. So like
Oh,
there have been these
absolutely.
NAPs who are like, oh well, this could be cardiac, and I'm like, well, yeah, anything can be cardiac. Like I don't know what you want me to do. Like we got to draw the line someplace. But then the state doesn't ever draw the line anyplace clearly. So then you're like, oh well, guess we're just gonna argue about it.
Yeah. That's something I gave
Yeah.
up years ago. I don't argue with you on calls. If you don't want to take it, you're not comfortable, that's fine. I'll take it.
Hmm.
Um, if you aren't comfortable with like something that's so BLS it's not funny, I'm certainly going to give you some crap on the way back from the hospital about it. But on scene in front of the patient, no, I'm just going to take it. We're not going to discuss it, argue it, nothing. Just all right, let's
Yeah,
go.
one of my one current partner, um, I can't really say that she's a newer. I mean, she is kind of newer. She got her EMT right around the time that I got my medic.
Okay.
So she's right around 2 years.
Yeah.
But
So I'm
and
assuming
I
it's first DMS job for.
Yep.
Okay.
And this is her first job in medicine period. And I actually talked to her on our last shift and I was like, "Hey, I'm doing this podcast. Do you mind if I talk about some of our, calls and stuff?" And she's like, "No, that's okay." But she when she first started, she was very, very, very green. Like
Yeah.
um it was a lot of me holding her hand and not just holding her hand through things, but like dragging her, kicking and screaming through things. But there was a lot that she at first was like overconfident about. And then when she actually like realized how calls run, she had no confidence in herself at all. And I'm like, listen, we gotta work on this.
We got to find a
So
happy medium here.
yeah, it's been a lot of work, but she's finally to the point where she's comfortable with what she should be. Like
Good.
one of the first shifts that we worked together, it was definitely not a BLS call by any means, but it was for one of our frequent flyers who's a COPDer. always calls for shortness of breath. And there was a tree down blocking her driveway.
Okay.
And so I had already called for the fire department and everything, like as soon as I heard the address. And we get there, we get her out of the house. The fire department helps us get her through the woods back to my truck. And we get in the truck and she just like sits on the bench seat across from me because I'm very fortunate. I have double bench seats in my trucks.
Okay.
And she just sits there and stares at me. And I'm like, are you going to do something? Like,
Yeah.
other than exchange oxygen for carbon dioxide? Like, do something. Like,
Yeah.
get me vitals.
Yeah.
No,
Well,
nope. She just sat there and stared at me for a minute.
when they're brand new, you gotta sometimes remind them of that.
hmm
And then yeah, yeah.
I never
But
understood the full whole like freeze thing. Like even like with being pretty inexperienced EMS getting into doing my medic and stuff, like I was like, all right, well there's something I can do. Like I'll check the blood pressure
Yeah.
again. You know what I mean? Like there's only something you can do.
Well, and that's why it was nice when I first got into EMS because I mean, I already did it in the ER. It's just in a different setting. So I had an idea of, what needed done and in what order. And, I did hear a lot from, my partners how they're like, "Oh, it's so refreshing having an EMT who's not like, deer in headlights." I'm like, "Yeah, because the ER already broke me of that."
yeah, but that's the thing. You had that experience to be broken.
Yeah.
A lot of EMTs obviously coming out brand new,
They're
um,
very fresh, very green and
especially the ones that went through during COVID, where
oh yeah.
they didn't get the benefit of a lot of contacts or a lot of like clinical or lab time.
Yes, I noticed there's like some programs will like really emphasize that they want EMT students to be in a hospital doing some sort of like
hmm
observational time or whatever there. And some programs don't require that at all. So since you worked in
No.
the hospital for a while before you did that, do you think that that gave you any sort of like advantage with like other
Oh,
than
absolutely.
familiarity?
It let me learn how to talk to people. Like,
That's an important and often overlooked thing.
yeah, like and I see it in my students too, is they're so used to talking to the instructor. Like, okay, well, I'm going to do this. What's going on with my patient now? I don't know. Ask them.
Well, so let me phrase it this way. Like if you were to replace the amount of time that you had um in hospital with truck time, right? You would still get the opportunity to talk to people. So do you think like
hmm
being in the hospital itself and like watching the entire healthcare system from physician
hmm
up down, like do you think that that specifically gave you a unique advantage whenever you started running on a truck?
I absolutely do because I know what the process is once we get them to the hospital. So I know exactly what labs are going to need drawn for which complaints. I know who's going to get an EKG. And those are things that I can start in the field. Like I can make, okay, this person has this going on. They're probably going to end up needing a CT with contrast. So I'll make sure that I start an AC line rather than, something more distal. Um, I know what like the thought process of a lot of the docs that I worked with, and that just helps me anticipate, what I'm gonna need to do with my patient. So like I wouldn't change my time in the ER for the world. I
I
think
think
it helped me make me the provider I am today.
I think the sheer volume too
Oh yeah,
um,
absolutely.
is helpful.
I'll tell you what, as a tech, like one of my big jobs was doing the EKGs. I can do a better EKG than most medics, like anywhere, because I would do
Oh yeah,
more EKGs in one shift in the ER than most medics will do in a year. Like it
oh
was
yeah,
insane because we were a huge cardiac center and the number like anybody who had anything that could be even considered cardiac, like you come in for shoulder pain that wasn't clearly obviously musculoskeletal, you're getting an EKG and you have to have it done within the first 10 minutes of the patient walking in the door. So I got really good at getting really clean EKGs because when they're not clean and you get lots of artifact, the doctor's just going to tell you to do it over again. So I got real sick getting told to do over again.
fair enough. That'll get you to do it. You ever have somebody else put your leads on and you don't watch them carefully and you get the printout and you're like, what the heck is going on here?
hmm
It's just like this
I'm
is
real
all backward.
nitpicky about my lead placement. Like I'm really particular about it. And whenever
Here's
I can definitely tell whenever something is awry
yeah.
because I'll be like,
That's what the
Here's
what
limb
in
leads.
God's name? Well, not even just the limb leads, but like the placement of all the leads. Like it makes me crazy whenever people put V3 like dead center.
I put V3 right
I
here.
have
That's where it goes.
That's
right here.
correct.
Yep.
Okay.
That's correct.
No, it's just like
You
that's
can
one of my
trust me.
little
I'm on
like
the internet.
irks. That's just one of
Oh
my
yeah.
little irks is like my lead placement.
Yeah. No, I agree. Here's a question. I had a partner who would not lift the breast up to place the leads. Like right over, whatever's there. Like the amount of old women with electrodes on their nipples that he brought into the hospital was very high. Um,
I mean, to an extent, like obviously like I'll move anatomy if I need to move anatomy, but technically speaking, our landmarks are not tissue. Our landmarks are ribs and intercostals.
correct. But you want to get
So
it as close to it as possible.
I'm not gonna put an electrode on a nipple, but
Yeah.
I don't think it's physically possible to palpate the intercostal space though with some of these patients.
oh yeah, absolutely not. Like it's kind of one of those, well, I think your fourth and fifth ribs are right around here, or at least they should be.
Yeah.
That's where I'd put them.
Eh,
On the nipple.
just eyeball it.
Yeah, no, like if I were going to
No,
give
we've
them their
already
fourth and fifth
established
ribs,
it
that's
goes
where
right
I'd put
here.
Uh,
them.
right
Correct.
here. I wonder what would happen if you put one there.
I don't know,
One,
but now I kind of want to try it.
right? You know, maybe it gives us like this the 13th view of the heart. You know,
I doubt it.
You don't know though.
I do not know.
So, huh?
Kind of wonder how if the like monitor would freak out about the placement.
I don't
Because you
know.
know how you know how sometimes it'll be like possible lead,
Yeah,
like
it only catches it when it's like really bad though.
New
Which
yeah.
I
new
guess
STEMI
on the
mimic.
forehead would probably be really bad though.
New STEMI mimic V3 on the forehead.
Fair enough. So, what motivated you to go and get your EMS instructor certification?
So I would have friends going through like their EMT. Actually, it started with one of my friends going through his advanced EMT, and he would have questions for me. And I realized whenever I was helping him, I was like, oh, I'm actually kind of good at like explaining this stuff because I have horrendous ADHD and I have to break stuff down in like the stupidest ways for me to remember things. And I think it gave me a unique like look into people learning things in different ways.
Okay.
So I would go back to help with some of like the lab days and stuff every once in a while. And I just really enjoyed it. So I was like, oh, you know what? I want to get my instructor. And it took me a while to actually find an instructor class, but
Yeah.
What's your favorite thing to teach?
oh,
Lead
I,
placement on the forehead.
yeah, lead placement on the forehead. A lot of the assessment stuff, um, any, like medical or trauma, I like teaching assessment. Um, I'm really good at teaching splinting because that was one of the um another big thing that I had to do in the ER was all of the ortho stuff. So any of the like OCL splints, whenever people had fractures, I was doing those. And I was one of the techs that one of the primary training techs. So anytime we had new employees, I was teaching them too. So I really like teaching those. Somehow, because I'm the only one with the anatomy, I end up teaching the OB-GYN lectures too. So I don't mind that one.
Yeah. I, yeah, I don't know. Did I ever tell you about um the class where so one of the things we do for airway is like you build the model of like the upper or lower airway and then you
I
present it to
remember
the
hearing you
class.
guys talk about it on other episodes,
Okay.
but
It was funny, but kind of tying into what you were saying. Like I was laughing, and all the female instructors were laughing, but like the other male instructor that was there that day was like mortified. I'm like,
It's
well,
fine.
but yeah,
It's fine.
yeah. Aaron, what's that's a good question. So, what's your answer to that? What do you like teaching?
Um, I do like doing scenarios. I like leading scenarios just because I think I'm good at throwing curveballs in there. I like to see people struggle. I
You
like
like to
I
see
Yeah.
a
like
squirm.
I like to get the guy who's overconfident and thinks he knows
Oh
Oh,
what he's
yeah,
yeah.
doing,
I
and
love
just
that
give him
guy.
something that they're just like, I know you're not gonna get it because I made it tricky on purpose. It's gonna look like something else, and you're gonna think you know what you're doing, and you don't.
Yeah.
What about
Huh.
you, Fior? What's your favorite thing to teach?
I would have to say airway. I like airway.
You would be an
Yeah.
airway guy. You would be.
Yeah, I mean it's easy. I'm an idiot, so it fits, you know? Like stick a tube in the hole. Make air go in. Yeah.
If you wanna be an airway instructor, you have to start off by going, I've never missed a tip.
Oh, yeah. See the problem is I have before missed a tube.
Well, then
Yeah.
you're not an airway instructor.
Well, you know.
You're not qualified then.
Yeah.
I remember
Fire
I
him.
was at a skills review when they first came out with the stupid King Vision, and the guy's like, "I have an over 100% success rate with this." I'm like, "How do you have more than
Oh,
100%?
over?
What do you? That
Are you
makes no
counting
sense. What do
like
Innovated
you?
your
two people with one
practice?
tube.
Yeah. What do you? Or is it like you double tubing people? What are you talking about?
When they say dual lumen, like he's doing two
I
two
guess
airways, one tube.
that way you can always have air going in and out same time.
They ventilate each other.
Yeah. I was like, okay, bud, you're insane. But yeah,
Does
I
that mean
so
that you're not a fan of the like King Vision video laryngoscopes or
no, no, I don't mind video. I I like and think there's an absolute place for the hyperangulated stuff.
Mhm.
What I don't like about the slotted blades is they are good for only one thing, and that is innovation, which I understand is 90% of their purpose, but you need to fish something out of the airway. You cannot get in there with your forceps because of that stupid channels in the way. You know what I mean? And you can't, like, you either have, like, the forceps can't turn like all the way up like a hyperangulated blade can. So,
Hmm.
you need something that has a smoother approach like a Mac or a Miller. So,
Mhm.
I am and probably always will be a Mac fanboy. So,
Yeah.
just is what it is. It's my
I've
fave.
used both.
Yeah.
Um, yeah, there was one day, I had jumped in a truck to help another crew,
Yeah.
and the medic that was on the other crew, he had checked the airway and looked, and he's like, I don't see anything, you can try if you want. And I'm like, okay. But the bulbs on both of the Mac blades were really, really dim. And I'm
Yeah.
like, I can't see anything. So I'm like, well, screw it, I'll get a Miller.
Yeah.
And that was my first successful tube with a Miller. And I was like, all right, I
Now,
can do this, son.
well, they say most people. They say most people's preferred blade is whatever they got their first tube on.
Yeah. Well, my first tube I got with a Mac 4, but
Product idea: glow in the dark ET tubes.
I imagine whatever you would have to put on them to make them glow in the dark probably shouldn't be in your airway. I don't know though.
But could have like multiple layers. It could be like in between the plastic.
I mean, go for it.
And
I'm
then
not.
whenever your bulb dies, I can see.
I can see. Could you get like different colors? So like, isn't February breast cancer month? You could have pink
Ooh.
glowing tubes, and then like Christmas, you have December, you have alternating red and white for
Or like
Christmas.
Broslo tape colors, like the bigger they are, the color matches with the tube.
Yeah, or do something practical like that if you want to be a nerd.
You're like, I don't know what size ET tube I have. Quick, turn out the lights.
Yeah, why don't we put like a corresponding color on ET tubes to the Broslet tape?
like that would make a lot of sense.
Did we just solve like a huge problem in emergency
Dude,
airway
that's just what
management?
I'd be doing, bro. I'd just be out here
Yeah,
solving
it's
problems.
just over there. Aaron does two things. He eats raisins and solves problems, and he's
Dude,
all
that
out of
is.
raisins.
I have a couple more.
Uh,
I do need to get more raisins from the store though. I'm gonna
yeah. Aaron has a weird grape thing. Any form, whole
I
grapes, raisins, wine.
I mean, I'm not big on raisins. I like grapes though.
don't come at me with cranberries though.
What about
Oh, see, I
craisins?
like cranberry.
No,
I like
no.
craisins.
Get out of here with that noise.
What's it? Tell me why the craisins are bad.
There's something about them. I don't like them. I don't like where they came
Color
from. I don't like what they're about. I don't like what they
really,
smell like.
really sounds awfully racist of you to
I just
dislike
don't
the
like
craisins.
craisins. I'm answering your question honestly.
And I appreciate your candor.
Thank you for appreciating me.
Thank you for
Sometimes I don't feel
appreciating
heard
me
on this
appreciating
podcast.
you. What?
You're
Sometimes,
very hurt, Aaron.
sometimes I don't feel heard on this podcast. So it's thanks for letting
Huh.
me get have to say out here, you know?
Yeah. Huh. Seems like me and you might have to get a couples therapy after this.
Can we live stream it?
Absolutely. I saw this thing on TikTok that was like, looking for or first date idea. Go to a couples therapist and see how long it takes for them to realize that you don't even know each other.
That'd be funny.
Right. The other thing I thought that would be hilarious would be like go to couples therapy, same therapist with like a different person every week.
Somebody's done that. That exists.
Does it?
Yes.
Is there like documentation of this? I'd like to know how that
Yeah,
went.
there's a YouTube video and then the guy like he'll like get it's acted out, right? So then the guy like gets the girl to like leave the room and he like tries to see if they like recognize him from like the day before and then they'll like talk about it like blow don't blow my cover. Like
Okay. You'll have to send me the link to that. I want to watch it. Sounds funny. But
I'll have my people talk to your people.
could you can you set that out? So uh but anyways, back to what we were discussing. Are you a
Raisins?
fan of the video laryngoscopy or are you more of a direct?
It depends on the situation. Like, I think the last couple tubes that I've done were with video, but
Okay.
I just kind of like bounce back and forth. I was actually when we first got the video at my service, I was actually the first one to use it.
Nice.
Yeah.
What
Um,
uh what kind of scopes you guys using?
oh gosh, air track.
Okay.
Um,
I've never used those ones myself.
they're similar to the King Vision. It's got
Okay.
the um the like I think there's four different size blades that you can either use, like there's like a monocle thing that you can use
Oh, okay.
without and then if you want to use the video itself, it's like a screen that you plug into the top.
Okay. I think I've seen those actually. I messed with one of those on a mannequin. I didn't like the monocle or
I am not
video
putting my
idea.
face that close to somebody's mouth.
Yeah, exactly.
No, thank you.
Yeah, like I trust my skills,
If
but
I'm
like,
intubating somebody then there is a chance that there's something that's going to come up out of that airway at me. Hard pass. No, thank you.
If you give me a like a top hat and like a cane, I'll wear a
yeah.
monocle.
All right, bet.
All right.
Will you,
Maybe like a pocket
yeah.
watch.
I mean, how are you gonna have a monocle and not a pocket watch?
I feel
Well,
like those
it's an
kind of
ensemble.
like go hand in
You
hand.
would look absolutely ridiculous.
Clown shoes, if you will.
I will. But yeah, so you use the air tracks. I don't know. I'm not a fan of them. Which again could be just because I have not spent enough time with them. But I typically do not like channeled blades.
And the couple times that I've used it, I didn't even use the channel. Like, I'll use the channel if I'm like, I'll feed a bougie through the channel, but I hate preloading the tubes into that channel. I just don't
Yeah.
like it.
Yeah. See, like I thought the whole point of the channel was like you just basically line it up and let her rip, tater chip.
Yeah. And like all the times that I've tried using that method, like on a dummy, they did not work out well for me. And the tube doesn't want to slide nicely through the channel.
Yeah.
and I just feel more comfortable whenever I don't use it that way.
When in doubt, more lube.
More lube.
Shove it in there.
Just spit on it and push.
That's not
When in
aseptic,
doubt.
Fior. I don't appreciate you promoting that type of non-aseptic behavior. This is not the type
My
of branding I
apologies.
want for our podcast. I'm really sorry about him.
Yeah, as you should be. No, I do not spit on
Oh, now that you're correct, did you change your tune? Isn't that funny?
that I put into people's airways. So,
Just the ones that you don't put in their airways.
yeah, IV catheter, right on in.
That was one of the nurses that I worked with in the ER. That was one of his favorite dad jokes. Make sure you spit on it and put the pointy end first.
Yep, there you go. Hey, dad jokes are highly underrated, and I stand
Listen,
by that.
dad jokes. Listen, I do what I can to like lighten the mood for my patient. Like obviously there's a time and place, but if telling a crappy dad joke gets them to laugh a little bit and like lighten their mood of some. And like if they're like super nervous, which let's be real, like a lot of the people that call that have, actually have a reason to call,
Yeah, they're
they get
nervous.
nervous.
I had
Yeah,
a patient who reversed me the other day, where he was telling me jokes to like distract himself.
Eh, whatever works.
yeah. Were his jokes quality?
He asked me how cows say goodbye, and then he had me put my hands like this and do this, and then he like pulled my thumbs like they were udders. I was like, that was our last interaction together. And I was like, all right, we'll see you later. Hope your emergency surgery works out.
That's incredible. I love that. I love that for you.
I was just like, all right.
In the moment, like, did you factory reset?
It felt like forever. Like I was like, how many times is he gonna pull my thumbs?
Yeah, you got a little much.
And the nurse at the hospital was like equally as confused. She was just like, I'm gonna keep putting on the blood pressure cuff.
That's understandable, though, for her to be confused by your weird interaction with your
It
patient.
wasn't even a joke. He just like pulled my thumbs.
Yeah,
I mean,
It
I
was
feel like
utterly
I'd be a little
ridiculous.
uncomfortable,
It was
but
utterly ridiculous.
it is utterly ridiculous. I see what you did there.
that's funny.
Hey, 2 for 2. Uh, but yeah, okay, right on. Anyways, wow, this is what a day.
I feel
What a
like you got
day.
factory reset, bud.
I do. Pretty much every episode, Aaron says something that my brain just is like, nope, we're shutting down for a minute. We can't recover from this. But it is what it is. So yeah, I definitely definitely factory reset there for a minute. As did Aaron, I guess. I had 2 of you for a minute, and it frightened me.
I hope
Do you,
I've alleviated your fears.
Yeah, I
do
thought
you think the world could handle 2 Aarons?
absolutely not. There's
Horrible idea.
That's an awful idea. Yeah,
That's why I want to have kids though, because I just want to see what happens whenever there's 2.
yeah.
Oh God.
That's ooh. On that note, Megan, thank you for joining us today. Thank you for the consult.
Thank
Uh,
you for having me.
it's been a pleasure. And thank you everybody for hanging in there with us and saying what we have to say. We appreciate your continued support. For those of you that are interested in being on the show, please shoot us an email at thanksfortheconsult@gmail.com.
Later, Gator.
Later.